Hi, my name is George McKenzie. I'm not a doctor, but I have had a lot of kidney problems through the years, and I've learned a lot about the different types of kidney disorders. So I've created this video to help anyone who may suspect they're developing a kidney problem and would like to learn a little bit more about this topic. Chronic renal failure causes include a wide range of diseases, conditions, and disorders. There are also a number of related risk factors. Before describing the risk factors and causes, let's take a moment to describe exactly what this very serious kidney problem is. Chronic renal failure is a term used by medical professionals to describe gradual kidney malfunction. The words chronic renal failure mean the same thing as chronic kidney failure because renal is a medical term used in relation to the kidneys. One of the major functions of the kidneys is filtering wastes, toxins, and excess fluids from your blood. These are combined to form urine, which is then excreted. When you have chronic renal failure, this process breaks down. Waste, toxins, and excess fluids then begin to accumulate in the body. This makes it even more difficult for the kidneys to function properly, and without intervention, kidney failure eventually occurs. Chronic renal failure can take years to develop. Chronic kidney disease symptoms rarely show up at all in the early stages of the condition. It's usually not even diagnosed until there's been significant kidney damage and the kidneys are functioning at only a fraction of their normal efficiency. Chronic renal failure causes include the following diseases and conditions: kidney stones, kidney cancer, polycystic kidney disease, pyelonephritis, and glomerulonephritis, which are types of kidney infections. Renal artery stenosis, in which there's been some form of damage to the artery that transports blood to your kidneys. Bladder cancer, both type 1 and type
Kidneys are a pair of about 12 centimetre long bean-shaped organs. They lie at level of your waist on the back side of your body. Every human being has two kidneys which lie on the right and left side of the spine. The kidneys produce urine. The urine flows from the kidney through the ureter to the bladder. The bladder passes out the urine through the urethra. Kidneys have three important functions. They filter harmful waste products from the blood and drain them out via urine. They balance the level of fluids and salt in the body. They produce hormones. Chronic kidney disease occurs when there is a change in the structure or function of the kidney. An infection, damage, tumour or side effect of certain medications can cause kidney diseases. A kidney disease often has great implications on health and the function.
Now let's look at hyperkalemia, a life-threatening disorder that can result in cardiac arrest and death when diagnosed and treated late. Hyperkalemia is defined as a serum potassium higher than 5 milliequivalents per liter. Potassium is the primary intracellular cation or positively charged ion, and it is necessary for the maintenance of cell metabolism and cell survival. It can result in death, especially when the onset is rapid. A serum potassium of 7 milliequivalents per liter or higher requires emergent attention. What are the four major causes of hyperkalemia? The most common cause is decreased renal excretion of potassium due to renal failure. The kidney is the primary organ of potassium regulation in the body and is vital for the maintenance of normal serum potassium levels. Aldosterone is a hormone that is secreted by the adrenal cortex. Adrenal insufficiency in Addison's disease results in decreased cortisol and aldosterone secretion and potassium retention. Hyperkalemia can also be caused by excessive dietary intake, but it is uncommon unless renal function is impaired. Shifts of potassium from the intracellular space to the extracellular space can cause hyperkalemia. This can result from cell destruction, alterations in insulin production, and acidemia. Keep in mind that pseudo-hyperkalemia, a false serum potassium elevation, is